Why was medicine slow to advance in medieval times? Medicine was slow to advance because people didn't have the knowledge to help them understand the human body. This period was characterized by inaccurate explanations for illness, based on superstition and religion. People in medieval England believed that there were supernatural reasons for bad health and disease. Firstly, there was the belief that disease was the will of God and that He was either punishing people for their sins or else purifying them through suffering. The Catholic Church taught that attempts to cure these diseases were a challenge to God's authority. People also believed that supernatural spirits could inhabit people's bodies and cause illness, and that witches could be responsible for someone becoming unwell. Alternatively, astrology was sometimes blamed for illness. Someone becoming ill was often seen as a result of a particular alignment of stars and planets. These attitudes were due to a lack of scientific knowledge and the suffocating role of the Church in all areas of life, including education. The Church had banned dissections on humans, which meant that surgeons could not practice on bodies or learn from them. The Church also promoted the ideas of certain physicians who were ill-informed, and encouraged the application of religious solutions to diseases. This approach, of course, did not work. According to these beliefs, treatment for disease included praying to God and asking for His forgiveness, or showing repentance by self-flagellation. The Church also encouraged people to embark on crusades, or pay tithes, 10% of a person's income, as a way of gaining forgiveness for their sins, and therefore curing their illnesses. On the other hand, not all ideas were based on supernatural and religious beliefs, and there were a few rational explanations for the cause of disease. For example, the theory of miasma suggested that bad air caused by poor and dirty living conditions, dead bodies or rotting food, could cause disease. Another idea was that illness was caused by an imbalance of the four humours. The physician who devised the theory of the four humours was Hippocrates, an ancient Greek. He stated that there were four humours in the body: blood, phlegm, black bile and yellow bile. Each humour was supposed to have an influence on the body, and Hippocrates believed that balanced humours were important for health. He also believed in clinical observation, when a doctor examined and monitored a patient's symptoms before diagnosing their illness and their treatment. Hippocrates was an extremely influential figure in medicine, and today doctors still take the Hippocratic Oath, promising that they will not intentionally cause harm to their patients. Another important figure who believed in the theory of the four humours was Galen. Galen was an ancient Roman physician and surgeon who developed this theory by introducing the idea of opposites. He taught that illness could be cured by using treatments that contrasted with a patient's symptoms. So, if there was an excess of blood, which was hot and wet, a patient would need to become cold and dry. Galen also developed theories that contributed to the stagnation of medical progress until they were eventually proven wrong. He believed that blood was absorbed by the body as a fuel and made in the liver, rather than pumped around the body by the heart. Secondly, Galen carried out dissections on animals and transferred these findings to humans. He claimed that the human jaw was made up of 2 bones and that women had fewer ribs than men. Because the Church supported his ideas, Galen's erroneous teachings were followed as the foundation of medicine for 1,400 years. Surgery during the medieval period was drastically different to what it is today. Surgeons had no formal training and didn't understand the relationship between dirt and disease. Most surgeons during this time were barbers who combined cutting hair with small procedures, such as having a tooth removed or bloodletting. Some other popular medieval surgeries included amputation and trepanning, which was drilling a hole in the head to release demons. Surgeons used natural substances such as opium and hemlock as anesthetics. However, too strong a dose of these might result in death. Controlling pain was another problem faced by surgeons, as they often used cauterization, or burning the wound with an iron, to stop the flow of blood. As a result, people often died from the shock of the pain, or a loss of blood. Infection was also a very common problem. This lack of medical knowledge can be seen in the case of the Black Death, a bubonic plague that hit England in 1348. It caused painful buboes in the groin and armpits, as well as a fever and sickness. It would often kill a person in 5 days. In order to cure this illness, people would pray to God for forgiveness, carry strong-smelling herbs or light fires to prevent the miasma. Apothecaries created herbal remedies that could be applied to the buboes. On the other hand, some local governments used rational methods to prevent the spread of the disease. Cemeteries were built away from the areas people lived in, so the miasma could not reach the living, and towns introduced strict quarantine laws lasting 40 days, with some even banning large gatherings. However, they were not always right. Some local governments stopped cleaning the streets, believing that the smell of the rubbish would drive the miasma away. This was problematic as it then became a breeding ground for rats, which carried the plague-infected fleas on their backs. As a result, it is estimated that around 1/3 of the population of England died due to the Black Death. Ultimately, superstitious beliefs and the power of the Church prevented medicine from advancing during medieval times, as they did not provide the environment for new medical ideas to flourish.